Let's talk about health. I'm going to introduce you to two doctors who are going to talk to us about the West Africa International Health Summit that's coming on the 20th to 22nd of February. I have in the studio Dr. Joseph Boni. He's an emergency medicine specialist at the Komfanochi Teaching Hospital. Dr. Joseph Boni, you're welcome.
Thank you.
Also here is Dr. Paul Owusu-Donkor. He's a lecturer at the University of Ghana School of Pharmacy and editor, Pharmaceutical Society of Ghana. You're welcome as well.
Thank you very much.
So two strong men from the health sector coming to tell us about what exactly this is to achieve. And this is, of course, coming from the JoyNews Health Desk. So let me begin with you. The West Africa International Health Summit. What does it add to our healthcare system delivery?
So in terms of health, we've realized that health is not now limited to just one country. The cases of Ebola, like natural disasters, have shown that health is something that is equal in all places, and if you have a problem in one country, it equally spreads to the other. So we realized that instead of just having the knowledge in one area, one zone, we put together a summit that's supposed to bring all stakeholders on board. This will include your doctors, nurses, pharmacists, but even pushed on to look at the policymakers, the CEOs of the hospitals, and then not only concentrated it to Ghana, but across the entire West Africa and Africa region, to have people come on board, share ideas about some of the best practices in health, to look at ways of sustaining it and collaborating for further engagements in.
Okay, recently we heard of the Ebola. I mean, Ebola has been like a friend to DR Congo. Recently we heard that there's been another outbreak there. Is this a part of the discussion, and how are you going to, direct this conversation, by the way?
So interestingly enough, we have more than 3 presentations on Ebola at this summit. We're bringing ministers of health from most of the West African countries. So they're going to share their experience on how did we miss it, how did we find it, what did we do to curb the situation, learning from those that have experienced it so that you know what not to do wrong in case it happened in your sector. We're also taking advantage of bringing the people that have initiated the National Ambulance Service from Sierra Leone. And this was an aftermath of the Ebola, all the ambulances that were left there. What are they doing right? In the wake of Ghana having so many ambulances, how can we collaborate?
Do we have so many ambulances?
We're hoping to have so. We hear some ambulances are coming in.
Well.
So when those come in, we're looking at how are we able to collaborate with other agencies around Africa in training, in administrative support, and primarily basic primary health care. What are we doing right, and how can we share that?
Okay, so let me ask you, Dr. Donkor, what you can share with us as far as this health summit is concerned?
Thanks for the opportunity again. And so we have talked about the soft part. The hard part comes in when you realize that when you talk about health, it does not just rest with diagnostics.
Okay.
It would go into therapeutics as well. But then to aid in these processes, you need instruments. You need consumables, you need medicines. That's where I come in as a pharmacist, and that's what excites me about this conference that we are having. We are bringing on board a number of manufacturers and suppliers of these medicines. We are bringing on board a number of people who supply these technical materials that we need for our diagnostic processes. And so we are hoping that by collaborating through this network, we'll be able to finish with a conference where we know what to go for at what time, for which facilities, at rates that help us. And so we are running exhibitions throughout the 3-day event, which is starting just tomorrow, that's the 20th of February, and ending on the 22nd, that's Friday. And so beyond the discussions that we would be having, we want to be sure that, yes, we are putting people, health practitioners together, such that they are well networked, but they also know where to go to and get what items they need that would help in promoting the health that we all need.
And so this is open to who? I mean, I can just walk in because I don't deal with medicine. So, I mean, what's the target?
So the target right now, we are looking at primarily healthcare practitioners, the HCPs. But beyond that, we are looking at the general public as well. Information is important and it's critical. So once you are there, you are learning more from best practices out there. You take charge of your own health. Second thing is that for all healthcare practitioners that we are expecting to be in there, from medics to nurses to pharmacists, we have received accreditation with most of these facilities that provide CPD points for us. And so we are hoping that when we do show up at these, the 3-day workshop, we'll be able to get some accreditation for for whether you're a pharmacist, whether you're a medic, whether you're a nurse. And so, yes, first to healthcare practitioners, but again, open to the general public.
So how will the general public benefit from this program? I mean, when I come and I'm hearing you talk about all these technical terms and describing all these, you know, pharmaceutical terms, and how does it benefit me as a member of the general public?
So how this is going to be beneficial is that not all the general public are really not related to health. You might have some form of industry that is really health related. If we're bringing you the Minister of Health from Sierra Leone, from Cote d'Ivoire, who gives you the opportunity to sign an MOU with him on one of the products that you have. Or maybe as a young entrepreneur, it's a budding idea for looking at some wild medical application or intervention. Yeah. Come and pitch it to the people that have the funds to support you. We have investors coming all over the world, from China, from the United States, from the United Kingdom, and a lot of investors from Ghana as well. So it's a good opportunity for the general public to come in, come pitch your ideas in medicine, and some of our topics are really nicely broken down to allow for easy communication, even if you're not in the health field.
Okay, hopefully so. But finally, is there anything about do you get to discuss the health, the national health insurance system in countries using Ghana as a point of reference? Because that's important. If you're talking about health, I think the fundamental part of it is access to healthcare, and that's what the national healthcare insurance, health insurance, was supposed to do. But you're not sure about the state of the national health insurance. Not to say you're not officials of the national health insurance, but are you providing a platform where people can have this debate, this conversation about the system?
I like the way you're going about it. You pick health insurance. It goes beyond even health insurance. Now, note this. Ghana in sub-Saharan Africa was the first to start the national health insurance scheme. All countries in Africa, not just West Africa, in Africa,
they copied from us,
came to us to learn best practices from us. They have bettered it. Now there's the opportunity to learn that best practice from them. If you take
isn't that a disgrace?
No, I don't think that's a disgrace at all.
I mean, I don't know the way that the health system works, but if you have to learn from me and then you get better and then I have to come and learn from you.
You see, when we
that's
grow
like a
in
step
this
backwards,
world
isn't it?
with a competitive mindset rather than a collaborative one,
it doesn't help.
Then we are not helping ourselves. And that's why our theme is that we are collaborating through networking and technology to better the healthcare in Africa. I believe that the world has moved into collaborative processes rather than competitive ones.
Okay, exactly. Well, that's a very, very nice way of running my argument down, but then again, it's still quite
aside that, so I will answer that. We do have a section for national health insurance. I am sure it's really going to be a packed section. I'm hoping to see you there. And then also, aside national health insurance being one of the first things that Ghana had in place, also, emergency medicine, which has to do with acute care of patients, is also one of the things that Ghana was one of the first to start in the whole of West Africa.
And where are we now?
We're still doing well. It's 10 years of emergency medicine. We've spread out of having only a training program in Kumasi and spread across over 6 regions now. And we're still moving on. So we're taking this opportunity to actually launch the Emergency Medicine Society of Ghana, which becomes one of our highlights of the event at the opening ceremony. And also use this to look at speaking about the 10-year anniversary, which should be coming up in November this year. Promoting that acute care is what is important. If we can't help you in your worst time of need, then the healthcare system is not strong at all. So we're making sure that that is adequate and all of the healthcare system will follow through if that is safe.
I see that you have someone like Dr. Nsia Sari, who's the Director General of the Ghana Health Service, coming. But we also know that there are very key challenges. I mean, there are key challenges within the health sector. Are you going to provide a platform where you discuss all of these? I know some of my friends who are medical doctors who have completed their, housemanship, they're at home. Some of them say, Charlie, put it in the media, we don't have jobs. I mean, are you going to deliberately create some of these platforms that people like that can have a conversation with the people that matter in this area?
Thank you, and I think it is the more reason when you hear of a summit like this that is bringing the key movers and shakers in the sector together under one roof, that you show up and be heard. Usually we sit in our one corner and say things that we want to say without bringing it to the fore. One thing we must note here also is that it is not just the health minister of Ghana who is going to be there. You have the directors of health for other places that are going to be present. Okay. And once they are there, we learn best practices from them. Now, when you talk about engagement, employment issues, it's not only restricted to medics. It runs across. But again, bring us together. Let's have an opening ceremony where it's a plenary. We discuss these things. We break it down into the parallel sessions for day 2 and day 3 so that the findings and suggestions that we bring up during these parallel sessions are crystallized out and presented to key policymakers on the closing day, which is Friday, so that hopefully we have a dialogue that does not end on the day of the, conference, but it goes beyond that. And so I'm calling on, whether you are employed or unemployed, please show up at the Accra International Conference Center from tomorrow to Friday, and let's get a discussion going.
Okay, so run us through the details again. Let's wrap up.
So the conference is starting just tomorrow morning with the opening ceremony, which promises to be a really huge event. We're promising to make it one of the biggest events in health in the whole of West Africa, starting off at 8:30 tomorrow morning and running through early afternoons. And then break off into the sub-sessions where we're going to have fora in emergency medicine, fora in health financing, public health, traditional medicine, pharmaceutical forums, nursing and midwifery. And these would run with concurrent conferences in telemedicine, with workshops in ultrasound. And we have a big ultrasound group that is supporting us from China coming in to do advanced training in ultrasound. And all of this will be climaxed at the closing ceremony, which comes up where, as Paul said, we'll put together all the discussions that have been had. Put it into a document and then submit it to the relevant authorities to make sure that this conference not only does the 3 days, but then for an everlasting effect of its results.
I hope so. And so it's tomorrow. They're starting at the Accra International Conference Center. Go there. Let's keep the conversation going. Thank you very much for coming.
Thank you.
Dr. Joseph Boni is an emergency medicine specialist at the Komfanoche Teaching Hospital. Dr. Paul Owusu-Donkor is a lecturer at the University of Ghana School of Pharmacy. He's also editor for the Pharmaceutical Society of Ghana. Thanks once again.